I will speak for some time. I will share the story of one of my patients, and you can ask questions. I have the Q&A box option open, and in case you're not comfortable giving your name, it's absolutely fine. You can even ask questions anonymously, or you can chat with me. You cannot chat with each other. So before and if you have any questions in between, feel free to add them to the Q&A, and I might get distracted, but I will come to the questions at the end. Okay, so here I will start. I am going to start, and you may have heard me speak on PCOS before. I'm not sure if you haven't. Well, I have a few videos on PCOS, and the reason the reason I'm doing this webinar is a lot of women with PCOS struggle a lot. And the struggle is because the primary treatment for PCOS is lifestyle change. And making lifestyle change, as we know, and if you have tried it, as have I, you know that sometimes it is hard to maintain some of the healthy habits, whereas it may be easy to start when your motivation is high. So besides being a functional medicine doctor and a brain health coach, I'm certified in Tiny Habits. So Tiny Habits is a method of behavior change. And I realized after getting certified that women with PCOS should not need to struggle as much as they do. And there are a lot of things, and I don't want to get into the basics of PCOS because I assume those of you who have joined me here today, you already know what it is. But just as a recap, PCOS is polycystic ovarian syndrome. The most important thing to remember is it is not just a problem of the ovaries. It is a problem that has impact on all of our bodies, right from the brain, heart health, blood vessels, mood, gut, blood pressure, fertility, body weight. So the effects of PCOS are practically on every system. And the other important thing, which a lot of people, I'm surprised to know, don't know, is there is no specific treatment for PCOS. What we provide as treatment is basically taking care of the symptoms. But so far, there has been no curative treatment for PCOS. There are a lot of things in the research world that are coming up, but there is still nothing that is like it's not there is one PCOS medication which you take and your PCOS will go away. It is still the primary way of treating PCOS is through what I call therapeutic lifestyle change. Because when you say lifestyle change, sometimes people tend to dismiss it. Oh, all you have to do is just eat healthy and, walk a little, just do 10,000 steps, and that's enough. That may not be enough for everyone. So PCOS has multiple symptoms, as I said, and depending on your age and stage of life, what impacts you most may be different. For example, many young girls have PCOS, and adolescent PCOS is a time when the biggest concern for many of these girls is the acne, the excess hair growth, and body weight. Sometimes mood has a huge impact too. Whereas, a 17, 18-year-old girl is most of the time not really interested in knowing about fertility because that is probably the last thing on her mind versus a little older women in their 20s, 30s, maybe even 40s they may have different challenges. They may find out that they struggle with maintaining weight loss. They are planning for pregnancy and they find that it's difficult for them. Then they go to fertility treatments and a whole lot of, another direction. Then the third category is, women who are in the menopause or perimenopausal age group as well. Their problems are more related to the underlying problem of insulin resistance. So insulin resistance is a condition which is the main problem in PCOS, which is a condition where the hormone insulin, which manages your blood glucose levels, does not function as well as it should. And that results in belly fat, fatty liver, hypertension, then high blood pressure, then it's also, so in a very kind of simplistic way, we can also call it's diabetes of the ovaries. So PCOS is diabetes of the ovaries, fatty liver is diabetes of the liver. So the underlying problem of insulin resistance becomes much more prominent in women who are particularly after the menopause, because in menopause, so menopause is 1 year of no cycles, permanent stoppage of menstrual cycles. So estrogen and progesterone are two of the major hormones which are dramatically reduced, and in some women testosterone levels may go up. So this hormonal change also makes it much worse for your insulin resistance. So maintaining body weight, dealing with heart disease, high blood pressure, diabetes, these become mood issues remain throughout, whether it's in adolescence, middle age, or in older women as well. By older, I mean in the perimenopausal, menopausal women. So those are the basically all the different problems that women with PCOS face. And one of the biggest ones is weight loss. So women with PCOS often find that they are living with a higher body weight. I won't say higher than normal, because it is not always easy to define normal. And as probably BMI is not the best measure for body weight. Body weight is just one measure. There are other measures as well, which I am more fond of, things like body composition. But maintaining weight loss is a problem not just for women with PCOS. This is a problem for men as well as women with weight loss challenges overall. So what do I mean by that? Now, I'm going to share the story of a patient of mine, and how you'll understand that there are so many factors that impact body weight and impact management of any patient. And obviously what I'm talking about today is for information only. This is not medical advice, and you need to talk to your doctor about what is appropriate for you. But while I'm talking about weight loss and maintaining weight loss, one of the things I want to highlight is there are a group of women who have what is called lean PCOS. So lean PCOS meaning they don't seem overweight, obvious, like just from external appearance or by looking at a number on the scale, but they may have a higher percentage of metabolically unhealthy fat. There are different tests to find that. One of them is DEXA scan. The other thing that recent studies have shown is lean women with PCOS have probably problems at the level of the fat cell. And I don't want to get too much into the science, because it is important to know that there is science, but at the same time, my goal is always to give you things that you can implement right away, or at least things that you can talk to your doctor about. So lean women with PCOS are often missed because your doctor is not thinking of PCOS when you go to them with mood issues or irregular cycles or difficulty with pregnancy, because you don't look you don't look like you have excess body fat. So since one of the features of PCOS is that many so many women unfortunately take a long time to get diagnosed with PCOS. But on the other hand, I have also found that some women self-diagnose PCOS. That is also not something that I would definitely recommend, but then again, I'm a doctor. So why I say don't self-diagnose, because just your ovaries showing cysts on an ultrasound is not enough for a PCOS diagnosis. I am so shocked when women will come and say, "Oh, I have PCOS." I said, "How did you find out?" "I had an ultrasound and the ultrasound is showing cysts." I said, "Did you do your blood test? Do you know your levels of, the male hormones, androgens? Do you know about your blood glucose levels? Do you know your blood pressure? Do you know, are your cycles regular?" "No, my cycles are regular. They are not irregular. I just have the cysts in the ovary, so I have PCOS." That is not PCOS. So PCOS, by definition, all of you already know that, but I'm just doing a recap. Number one is what is called hyperandrogenemia, meaning excessive levels of androgens. Androgens are the male hormones, testosterone, DHEA. So those can either show in the blood as higher levels of hormones, or they can show as symptoms like excess hair growth in areas where, like the chin and upper lip, these areas where you don't normally have hair, or the hair growth is more than what it was before, and it is something that bothers you. So hirsutism, either in the blood or in symptoms, and cycles are irregular. You don't get a monthly cycle every month, you get a cycle every 2 to 3 months. And the underlying problem of insulin resistance is not a part of the diagnosis, because insulin resistance is difficult to define in different people all over the world. A lot of it depends on the ethnicities and having polycystic ovaries. Now, polycystic ovaries, the sonologist, the person who does the ultrasound, knows how to diagnose. There are some specific criteria for polycystic. Just one single cyst in the ovary, which goes away in 8 weeks, is not a polycystic ovary. So basically, the diagnosis is important, and particularly in younger women, adolescent girls, just having polycystic ovaries is on ultrasound is not enough for a diagnosis. So moving ahead, I'm going to share, and I'll pause for a minute. If you have any questions, feel free to type in the chat box before I share my patient story. Okay, so this is my patient, Tina, a 25-year-old single woman with PCOS, hypothyroidism, depression, and difficulty maintaining weight loss. She's on laser treatment for hirsutism. So her diagnosis of PCOS is not in doubt. So this is the standard treatment. Now, metformin is a medication that is used in diabetes. It has been used for many, many years. And in PCOS, it has been used with the thinking that it will help in the underlying problem of insulin resistance. Now, many people, and please feel free to share with me, because I have had my patients tell me, Doc, so I ask them, why are you on metformin? No, doctor, I'm on metformin to lose weight. Well, news, metformin does not cause a lot of weight loss. So again, it would depend on the dosage as well. And metformin by itself has certain problems, like many people cannot tolerate metformin because of GI. They have bloating and diarrhea and, rumbling in the stomach and things like that. So metformin is something many people cannot tolerate, and metformin does not really cause a lot of weight loss. So, but unfortunately, I found many of my patients, they think they are losing weight because of the metformin, but it's the other things they've lost weight from. So they kind of cling on to it like a crutch, because the doctor said, if you have PCOS, you need to take metformin. Okay, so number one is Tina was on metformin. Next, she was on Atorvastatin for high cholesterol. Now, Atorvastatin is what is called a statin medication for cholesterol. She is only 25. She has not had a heart attack or any chest pain or any cardiac event. There is no data to support that statins are helpful for women in the primary prevention. Primary prevention meaning you have never had a heart attack, stroke, or any of these conditions, and you are on a statin. Why I'm saying that, you will find out, because no medication is there which has only benefits and no side effects. So metformin, atorvastatin are two of the ones. She was on birth control pills for cycle regulation. Now, she did not need contraception. She was not in any relationship at this point. So because she missed a few cycles, she went to the doctor. Doctor said this is the standard of treatment for PCOS. So birth control pills. Next, she was on thyroid medication. So T4, Thyronorm is the commercial name in India, for hypothyroidism. Now, hypothyroidism and PCOS are very common in people. They are together in many patients, and there are multiple relationships. A lot of it is through the liver. But the most important point is both these conditions have to be treated, obviously. Now, with Tina, what happened is Thyronorm is a medication that needs to be taken on empty stomach. So 1 hour before taking the medication, 1 hour after taking the medication, you're not supposed to eat anything or drink tea or coffee or any of that stuff. Now, she was a young woman working. What she found is most of the days she'd wake up in the morning, rush and get ready and leave for work. And while she is, drinking a cup of coffee in her travel flask. And she said, doctor, most of the time I can't have the medication because I'm supposed to have it on empty stomach. So these are major clues. So her compliance with Thyronorm was probably in a week, she would manage it for 4 or 5 days max. She did not take the medication every day. Why am I saying that? Now, not treating thyroid optimally, and there are, I can talk about thyroid until kingdom come, but not treating thyroid optimally is number one, it does impact weight loss. Number two, her high cholesterol that her doctor diagnosed her with, hypothyroidism that is not properly managed is one of the biggest reasons for cholesterol abnormalities. So first and foremost, what did I do? Okay, let me finish with the rest of the medications, then I'll talk about each of them. Next, she was on lansoprazole. So lansoprazole because of reflux. And lansoprazole, omeprazole, rabiprazole, a whole bunch of prazoles are called proton pump inhibitors. PPIs have a whole bunch of problems that they create. So long-term use of these medications, PPIs, is definitely not a good idea. And they have been related to early death, brain function, magnesium deficiencies, and I will show a list of all the nutritional deficiencies they cause. Next medication Tina was on citalopram for 1 year for depression. So citalopram, many of you may recognize, is what is called an SSRI, selective serotonin reuptake inhibitor. Now, as you know, depression is not just a problem of low serotonin in the brain. That has not been proven, that has not been shown. So citalopram actually was not doing much for her anyway. It wasn't helping her depression. Then she was on some natural PCOS supplement that she bought through an advertisement on social media. So what was the first thing I did with her? Now, if you have any questions, feel free to type. Otherwise, I will go on and tell you what I started with her. And she, of course, she had lost weight. She got onto some program where they used a low-calorie diet. And if you've heard me speak before, you know that low-calorie diet is not something I recommend. So next question is, what do I recommend? I'll come to that. So she lost weight. And then after a year or so of doing that program, all her weight came back. And she said, I'm just struggling. I'm this horrible, hopeless person. I'm not motivated to do anything. I don't feel well, and I'm just 25. And what will happen to me when I'm like my mother's age? I will just be a couch potato and not leave my home at all. And that is not the way anyone should be living life, isn't that? Isn't that so? I mean, life doesn't have to be, and particularly I feel so sorry when it's like, young women who are struggling with anxiety and depression and, living with a higher body weight, and their well-meaning, parents, relatives, sisters, brothers, everyone's telling them, all you need to do is eat less and move more. That does not work. I'm sure many of you are familiar with that. All you have to do is, if you eat a slice of bread now, you just have to spend 1 hour on the treadmill and that bread is gone. Not true. Not true at all. It was never true. And unfortunately, a lot of people, including doctors, still talk about, eat less and move more, and your excess body weight will just go away. That is not true at all. So what is the first thing I did? The first thing I did is stopped her Atorvastatin, because that was not at all necessary for her, number one. And then got her to take her thyroid medications every day, regardless of meal times, because taking the medication is way more important than timing it precisely. The flip side is it may happen that your thyroid dosage may increase because food and liquids like tea and coffee, they interfere with the thyroid pill absorption. So obviously, if it doesn't get absorbed well, you may need a little higher dose, but I have not found that happening very often. So rule number one, take your thyroid medications. Don't bother with if it is a challenge. Now, some of my patients, it's not a challenge. So if it is a challenge to maintain that 1 hour before medication 1 hour after medication thing, then just take it whenever you can. So 100% compliance on thyroid medications is extremely important. Next thing, I asked her to stop them Atorvastatin right away, because like I said, she doesn't need it. And true to, this is not magic. This is science. 6 weeks later, when we repeated her cholesterol, her levels had come down, because she was already she was taking her thyroid medications regularly. And her thyroid levels were also where they should be in the optimal range. Now, when it came to lansoprazole, the challenge is many people feel they kind of need it because otherwise they're going to get reflux. But very often the reflux is because, most commonly in my practice, I found it's because most people eat too late in the evening. Again, that may not be your problem, but in India, people have dinner very late in the night. And then just after that, they go off to bed. So that was one of the things I told her, can you have your dinner early? And the next thing, of course, when it comes to weight loss, when I said that I don't usually recommend the eat less, move more, what do I recommend? So I recommend a lower carbohydrate diet. And today I won't have time to go into the details of how low amount of carbohydrate you need to eat, because the underlying problem in PCOS is a problem of carbohydrate intolerance. So obviously, if you're eating a lot of, rice, pasta, roti, bread, pizzas, burgers, that is all carbs, that is all sugar. So carbs are things that eventually become sugar. Many of my patients say, doctor, I eat only rice and, rotis. So these are the common food in India. And when I tell them, that's just sugar. There is no protein in it. There is no fat in it. So that is not going to help you with your weight loss. So food is primary when it comes to weight loss. And of course, there are all the other factors, sleep and movement. I'll come to all of them one by one. So then lansoprazole, I said, okay, first you need to change your food. Another tip, apple cider vinegar. I'm sure many of you are using it already. So the liquid is usually the best, but sometimes when you're traveling, you can't always carry a bottle of apple cider vinegar with you. There are capsules available as well. Now, I don't know whether both of them work equally well, but I have found, and so have many of my patients, that apple cider vinegar capsules can work well for reflux. And as you probably know, taking apple cider vinegar after a meal has shown blood glucose levels to be lower than when people don't take apple cider vinegar. So I said, okay, start with the ACV, and slowly you will need to get off your lansoprazole. Citalopram for depression, that was the last medication that I was going to deal with, because I asked her whether this was one of her goals, to get rid of, to stop her citalopram. And I was not the doctor who had prescribed citalopram, because that is not my prescription medications, SSRIs. These are not my first line of approach for depression. Now, here I'm not talking about major depressive disorder. Those are different. Tina did not have major depression. So her problems were probably from somewhere else, and I'll come to that. And the natural PCOS supplement did not have anything that had any data with, and so the ones that have the PCOS supplements that have data are, one is myo-inositol in a 40:1 ratio. Chromium at a higher dose has some impact, but these are, as the term says, these are in addition to food and all the other lifestyle change. Because one of the big problems with these natural supplements is quality control. And many of them don't go through any kind of quality control. They don't go through any clinical trials. Some of them do, but they're sometimes small. So the person selling the supplement will talk about, a chromium that is present in this particular supplement has shown benefits. Yes, chromium has shown benefits, but was it at the dosage that is there in your supplement? And this particular supplement didn't. I had a whole bunch of stuff I had never heard of. So I asked her to stop that right away. Now, what happened? So the other thing is, I asked her, what is the most important, what are in 3 months' time, what are the top 3 things you want to see happening? And she said, "Doctor, I just want to feel better." I said, "Is weight loss one of your goals?" She said, "No, not at this point in time. I am not going to look at weight loss. I have too much baggage around, losing weight and this thing of, everyone telling me I'm just lazy and I eat junk and this and that." So, point to note, just because your doctor, your relatives, your friends, your boyfriend thinks you should lose weight, that is not a very good reason. Do you want to lose weight? Are you looking to, are you looking for weight loss? Because weight is one number. There are a whole lot of other things. And particularly for someone like Tina, who had a lot of challenges with, her mood was the biggest problem she had. So unless your mood gets better, how are you going to make bigger changes? So your motivation is never going to be very high if you're just not feeling well. Like one night of poor sleep can make you feel unwell. Do you all agree with me? And here she was not feeling well, and I'll come to some of the reasons why she was not feeling well. So as you know, in functional medicine, we look at food and nutrition first, and here comes something very interesting. So many of my patients are shocked, surprised, I don't know what else. Doctor, why doesn't my doctor tell me all this? So this is something called drug-induced nutrient depletion. That means when you are on these medications, they deplete your body from multiple nutrients. So metformin, vitamin B12 deficiency, birth control pills cause deficiencies of a whole lot of these things. More importantly, one of the things that I'm a former OBGY, we didn't even know a lot about it. Birth control pills can affect your mood very, very strongly. Doesn't happen to everyone. So birth control pills and depression has a major connection. So she didn't need contraception. And I told her, I said, if your cycles are not 100% regular every month, are you comfortable with that? She said, yes, I am comfortable if it's going to, improve my mood if I stop my birth control pills. So what I did is I switched her from birth control pills to oral micronized progesterone. So that is progesterone in the second half of the cycle. So oral micronized progesterone is the progesterone that our bodies make naturally. And in women with PCOS, they don't produce an ova every month, some of them. That is why the irregular cycles and the missed cycles. So they do not make adequate progesterone. And progesterone is very important for mood issues, for brain function, for anxiety. So I told her, okay, are you willing to switch to an oral micronized progesterone instead of the birth control pills? So she was happy to do that. So she did that. Now, statins, she was on atorvastatin. In my opinion, she did not need that at all. Can you see the list of, nutrient depletions? Coenzyme Q10 is extremely important for your cellular energy. So if your cells don't get adequate energy, how are you going to feel energetic? Vitamin D deficiency, vitamin E, beta carotene, all of them extremely important for energy levels, your body functioning well. Antidepressants, she was on citalopram. Citalopram is one of those medications which causes weight gain. So first of all, I asked her to talk to her psychiatrist who had put her on the citalopram and find out if, number one, he would be happy to help her with the deprescription. Deprescribing antidepressants is a very structured process. You cannot stop many of these medications cold turkey, should not stop. And in case you can't stop right away, is it possible for you to get on to any of the medications which don't increase body weight? Next is the lansoprazole. Look at the whole long list of deficiencies that lansoprazole use can cause. Now, next question, I'm sure all of you are wondering is it possible to test these nutrient deficiencies? Just because, I am saying and quoting some literature, does it mean that this is what is happening to you? Some of them we can measure in a routine lab. B12 we can measure. Folate is not folic acid in blood. It is something called formiminoglutamate acid, FIGLU. FIGLU I don't test routinely because it is not available everywhere. It's not necessary. Calcium, a blood calcium test will not tell you how much calcium you need because most of your calcium is in the bone. Magnesium, similarly, a blood magnesium test will not tell you about deficiencies because magnesium, most of magnesium is not in blood. And there is a special test called RBC magnesium, which is not available everywhere in the world. Vitamin C, vitamin E, we don't test routinely. And this is where I'm talking about routine labs. All these tests can be done on specialized micronutrient testing, which is not, again, not available all over the world and it costs quite a bit. It's around 500 US dollars. So I don't recommend that for every patient, because if I can find that, just on basic lab tests that she's deficient in B12 and and iron and vitamin D, I can assume that she would be deficient in the others because it's very unlikely she'd be deficient only in one type of B vitamins. But some of our patients want to know really what is going on at the tissue level. And if you're happy to invest that money, of course, you can get the test done, but that test is, again, not available everywhere in the world. Coenzyme Q10, routine lab tests, we can't. Vitamin D, we can test on routine lab. Vitamin E, beta carotene, again, specialized tests, not always necessary because these are supplements. So you can take them. But one thing you have to remember, vitamin E, vitamin D, these are vitamin A, these are fat soluble vitamins. So if you take more than you actually need, there is a chance of toxicity because they can accumulate, versus B vitamins, C vitamins, folate, these are water soluble vitamins. So your body does not retain them. They go away in the urine. PPIs, as you can see, also causes iron deficiency. Iron, we can definitely check in blood. Zinc also we can check. B12 we can check. So what I found with Tina is she was deficient in B12, vitamin D, iron deficiency was very severe. And iron deficiency you cannot diagnose by just doing a CBC. This is something a lot of people don't know. When I say, you could be low in iron, patients say, doctor, my hemoglobin is good. So no, hemoglobin is the last thing to change. There are iron studies, serum iron, ferritin, total iron binding capacity. So you need a little advanced iron testing to know whether you have a problem with iron deficiency. And iron deficiency is extremely common in many parts of the world. 60 to 65% of women have iron deficiency. And iron deficiency can make you feel terrible. You feel weak and lethargic and unable to do anything much. So here I'm going to pause, and if you have any questions, please feel free to type them in the chat box. Otherwise, I'll move forward to the next section. Okay, I will carry on. So here she had these deficiencies. So what did I do next with her? First, I made her stop those medications that she did not need. Then she was, obviously, first thing I started off with is a low carbohydrate diet. So low meaning how low? As low as you can go. And for a lot of people, particularly if you're vegetarian, it is very difficult to go low carb. So one thing to remember is each person has a different carbohydrate threshold. Your carbohydrate threshold may be just like mine is probably 30 grams a day, probably even less. And one apple is 20 grams of carbs. So you understand how difficult it is. So you may have heard of the ketogenic diet where people eat very small quantities of carbohydrates. So a ketogenic diet has shown benefits in women with PCOS, not just with weight loss, but with, cycles returning, fertility getting better, whole lot of things. So a ketogenic diet by definition is a very low carbohydrate diet between 20 to 50 grams of carbs a day. Now, many people make the mistake of thinking that the ketogenic diet is a high fat diet. Now, the fat component is important in specific things like mental health disorders, bipolar disorder, schizophrenia, these conditions, epilepsy, where the fat percentage is higher and it has to be calculated appropriately. And obviously, you're not going to attempt those things by yourself. Many of them, you have to be admitted in a hospital, particularly for severe mental health challenges. But for, a sort of garden variety PCOS, you're doing a lower carbohydrate diet at home. You may not need a very high amount of fat. The most important thing to focus on is the amount of total carbohydrate. Stop focusing on net carbs and sit and calculate how much of carbs is there and I deduct the fiber from it. No, just look at the amount of total carbohydrates you're eating in a day. Multiple calculators available online, and if you don't want to go into any of that, there are lots and lots of lists of low carbohydrate food. So number one, prioritize eating protein. If you eat meat, fish, eggs, fantastic. Start with those first and add vegetables. Enrich the vegetables with high quality fat like butter, olive oil, ghee. Seed oils, as far as possible, stay away from them because they are very inflammatory, and inflammation is related to a higher body weight and mood issues. Nothing good about inflammation continuing in your body for a long time. So, and food is the number one cause of inflammation in 90% of people. So the right food for you is important. So what did I do with Tina next? So first is she stopped her Atorvastatin, the statin medication, which was likely causing all these problems. Then I asked her to switch to oral micronized progesterone in the second half of her cycle instead of the birth control pills. So next cycle, she changed that. Number three is I asked her to talk to her doctor about the Citalopram, if he could give her something that is body weight neutral, and help her with the deprescription. But that was going to be the last thing we were going to deal with, because the deprescribing, as I said earlier, is a structured process. It's not just stopping cold turkey. So those are the things. Then next is I gave her supplements to correct her vitamin B12, vitamin D, iron, B complex, and multivitamin, omega-3 fatty acids, which we did not test here, but there's a test available. You can get the test done worldwide. So omega-3 fatty acids are very important for mood, blood glucose control, brain health, heart health, inflammation, you name it. And you cannot get enough omega-3s even if you eat salmon every day. So for most people, it's impossible to get that amount of omega-3s. So supplements for omega-3s. So what happened? Now, what I want to highlight here is, managing a person with PCOS and all these numerous symptoms, it is not just a one visit thing. You come and meet me once and I ask you to do a bunch of labs, and then I send you home and you send me the reports and you get, the nutritional supplementation looked at and adjusting medications here and there, and you're good to go. Not always. It's a long-term process. So one of the things that studies have shown, in particularly weight loss, was those who had a follow-up program, those who were on long-term programs. The first phase of the programs may be very intensive, whereas the later phases are less intensive. They did much better. So you might be wondering, why am I talking about Tina when weight loss was not one of her goals? And I'll tell you what happened with her. So here you can see these nutrient deficiencies. And one more factor, which I think sometimes, a lot of people are not aware of, is what are the expectations for weight loss? Now, unfortunately, maintaining weight loss, that means you lost weight once and maintaining that over a time of, let us say, 5 years, the percentage of people who are able to do that is very less. And there are numerous reasons. Today, I'm not going to go into that. In fact, very soon, end of October, I'll be in Bali, in Indonesia, doing a workshop where I'm going to talk about why is it hard to maintain weight loss. This is an event for doctors. Even those who are not doctors can come and join. I will send the link once their website is ready. So why is it difficult to maintain weight loss? Number one is, what are your expectations? So if this is your desire to lose a lot of weight and all you're going to do is just manage your food, it is 5 to 10% is not an insignificant weight loss. But you may not reach your desired, let us say you want to lose 30 pounds. That's about 15 kilograms. Now, 30 pounds weight loss may not happen like in just 2 or 3 months. This is again average. Some people have lost more weight, and again, I will go into that. I'm just keeping an eye on the time. So that is very important to keep in mind. So with all the lifestyle changes, 5 to 10% is in the best of cases. So if you have a lot of weight to lose, maybe it's time to look at, medications. Some of you may need bariatric surgery if you have multiple, what we say, comorbidities. You have diabetes, you have fatty liver, and a lot of other things going on. Then come the newer medications like Simaglutide and Terzapatide, which many of you have probably heard of. Now, these medications are, for some people, they have worked dramatically well. In a very short span of time, they have lost a lot of weight. They feel much better because for the first time in their lives, they have managed to lose considerable weight. They don't feel, joint pain and things like that. They're able to do more. They're able to exercise more. Their mood gets better. So my point is, sometimes some of my patients will say, doctor, I don't want to get onto a medication for weight loss. For some of you, it may be necessary. And until and unless you get your, head around resisting those, you'll have to figure out, or at least tone down your expectations and not blame yourself for, oh, I'm not able to lose weight because I'm lazy and I have no motivation. That is not true. If the only thing you go away from today is you are not living with a higher body weight because you're lazy and you eat too much, I would have done my job. So next is, this is the realistic expectations. And like I said, most people are not able to maintain the weight loss, but some people are able to maintain the weight loss. So what do they do differently? If you heard me speak before, you know that I have talked about food addiction. So one of the first things they did is so changing your food environment. If you eating mostly at home, not eating outside, what happens when you eat outside? Obviously, the oil they use, the kind of ingredients they use, they are not providing you with the best quality ingredients. They are looking at the bottom line, which is the cheapest. And cheap oils are very high in something called trans fats. So trans fats are the worst possible fats on earth. They increase inflammation, they raise your risk for heart disease, stroke, dementia, anything you name. So trans fat is one major one. So if you, let us say you have food, I'm coming to food addiction next. If you crave sugary food all the time, so, and you don't have sugary food at home, and you are not the type of person who will, go to the nearest store and buy sugary food. But nowadays, sometimes convenience is making our lives harder in a way in terms of health. All you have to do is click a few buttons on a phone app, and food is readily available at your door. So that is one challenge you'll have to, and these are the things I teach on my course on Tiny Habits for PCOS and better health. So what is it that if you don't have sugary food at home? I was telling a patient some time back, she said, doctor, I crave chocolates, and after every meal I need to have chocolates. I said, the chocolate didn't walk into your home. Obviously you got it. So do you think you can stop getting the chocolates? And I can relate to it. If we have any chocolates or anything at home, I get that that desire to have it to the point where I'll finish it. The other thing is overcoming unhelpful relationship with food. And I have talked about food addiction before. There is a questionnaire called the Yale Food Addiction Questionnaire. Food addiction is real. And the problem with food addiction is, number one, a lot of people don't know about it. So if you want to know more, and if you suspect you have a food addiction, number one, just do an internet search for the Yale Food Addiction Questionnaire. And Dr. Vera Tarman, Veratarman, Dr. Vera Tarman she is a addiction medicine specialist, and she talks about food addiction. She has a book called Food Junkies. She's in Ontario. She has a Facebook group, which is free. So you can look out for, you can go to her Facebook group, and she provides a lot of help for free. There are a lot of online groups where you can get free help. But my point is, food addiction will not just go away by moderation. Don't eat, instead of the whole chocolate, eat a small bit of chocolate. No. as the term addiction explains, see, food is difficult because you need to eat to survive. You don't need cocaine and alcohol to survive. Those are the addictions most people are familiar with. And unfortunately, food addiction is not something even doctors are not aware of it. They don't screen for them. And a lot of people are not aware. They just have this. And, studies have shown that sugary food, high sugar food, high carbohydrate food can light up the same receptors in your brain that cocaine or any of these addictive substances do. So food addiction is real, and until and unless you have solved your challenges with your relationship with food, it is nearly impossible to maintain better health. So let's say you have this massive goal of losing 30 pounds and 40 pounds, but you still have a relationship with food where a little bit of stress or anxiety makes you eat a lot of sugary stuff, then obviously all your efforts are not going to show up the same way until and unless you've solved the problem. Some people need professional help with food addictions, so that is important to keep in mind. Next is eat more protein. So this is people who were able to maintain their weight loss. And like I always say, start with protein first before you start, reducing the sugary food and all those things. Once you eat enough protein and good quality fat, you will find that you don't feel as hungry. Versus when you eat more carbs, you are going to be hungry in 2 hours. And then you just crave all these things and you eat whatever is available in front of you. Now, studies have shown that people who eat more protein, and more is, again, it's different people need different amount. Most people are not eating enough. So 1 to 1.2 grams per kilogram of body weight is sort of the minimum. If you are more physically active, you need higher amount of protein. If you are older, someone like me, I need more protein. This is something a lot of people don't know. They feel they need to eat a low-fat diet to lose weight. That is not true. So fat, high-quality fat like olive oil, butter, ghee, fat from fatty meat, fish, that does not make your body weight higher. That, in fact, can help you lose weight. So studies showing where they prioritize protein, what they found is, and this is where it's very important to keep in mind that body weight is just one measure, one metric. It's not enough. Look for body composition. So what do I mean by body composition? Body composition is when you look at so there are some home blood pressure, I'm so involved with blood pressure that's the first thing that comes to mind. So many of the home weighing scales can show you body weight, body composition, so amount of muscle you have, amount of fat, and how much of the bones, because your bones, organs, muscles actually weigh more than fat. And in fact, I don't have that slide here, but there was a very nice slide. There's a lady on Instagram where she showed 2 pictures. Her body weight was the same, but in one, you could obviously see she was much more muscular. As my son would say, she's ripped. So body composition is important. Just if you're just following the number on the scale, what you may feel is, oh, I'm not losing any weight, but it may end up that you are actually gaining muscles and you have lost fat, but the total number remains the same. So you're frustrated. It's not working for me. It's like useless. I'm trying so hard. So what they found is those who ate more protein, their body composition changed for the better. So they lost fat and gained muscle. Muscle is extremely important for your blood glucose management. Muscle is your biggest friend, and developing muscles, number one is adequate protein intake, low inflammation, and weight-bearing exercise. So moderate intensity exercise, that is extremely important. They ate more vegetables. And in the interest of time, I'm going to sort of rush through a few because they don't sit continuously, because what I want to focus on, of course, they ate less of sugary and ultra-processed food. That's no surprise. Regularly monitoring weight. This is something that studies have shown it helps, but I have a different opinion because personally, I don't like to weigh myself. Maybe that's what colors my opinion. But I have found a lot of my patients don't want to check their weight. And I'm okay with that. But the fact is, as I always say, nobody loses weight without knowing. Sometimes some of my patients will say, doctor, my friends say my body is better toned. So likely what has happened is they said, I don't want to look at the weighing scale because it's so frustrating for me. So regularly monitoring body weight, why is it important? So my friend and associate, Dr. Iyer, she's really very focused on her weight, and she checks her weight very often. No wonder she's really lean, whereas I don't check my weight as often, and I am not lean. So the point is, the sort of the theory behind measuring your body weight regularly is so that once the trend starts going up, when you start gaining weight again, if you catch it early, then you can take measures early. So that is the theory behind this. But again, I leave it to each of you, in like it's an opinion. And if checking your weight often is going to cause you more stress, definitely don't do it. There is no one right way for everything. And what was the other thing that weight loss maintainers did? They used a problem-solving approach. And this approach is very important because this is what I teach on my course, Tiny Habits for PCOS. And I am going to launch the next one later on, maybe January, I'm not so sure. Using a problem-solving approach. Or one thing I need to mention is, those of you who are on this webinar today, and I know many of you have registered, but you couldn't show up because you're going to watch the recording. You will also be added to my email list where you'll receive emails regularly, hopefully regularly, on PCOS. And if you feel that that information is not relevant to you, feel free to just unsubscribe. There is an unsubscribe button at the bottom. And please don't send me an email saying, please unsubscribe me, because there's a lot of things that I have to do, or one of my VAs have to do. You have to go into the back end, check where you are, figure out, and then unsubscribe you. It's way easier for you to do that. So using a problem-solving approach rather than blaming yourself, like I am this hopeless person who can't do anything, I have no motivation, I am useless. And sometimes that feeling is kind of made worse by your friends and your well-meaning family telling you all you need to do is eat less and move more. The last one, which is the most important thing, which has come across multiple studies, is increased physical activity. Now, increased physical activity meaning what? So moderate to high intensity exercise for most days of the week. And many of these weight loss maintainers, those who were able to keep the weight off for longer than, most of these studies, I think, looked at longer than 4 or 5 years, is they were doing moderate to high intensity activity for at least 1 hour every day. So figure out how you can do that. Now, in the Tiny Habits method, I teach you a way to do it, because when you join a program, most of you are very highly motivated to make major changes. And at that point, and particularly once you start feeling better, you can definitely start on an exercise habit. And in the Tiny Habits method, I teach people how to start an exercise habit, and more importantly, how to maintain it, how to increase the intensity. Because see, what is the biggest challenge with most people and physical activity? Well, on multiple surveys, people say, I'm not motivated enough to do it, or I don't have time. Now, the fact is, motivation is not a reliable thing. So until and unless we make it such that it becomes a habit rather than relying on motivation and high. So what will you do when your motivation is very low or you haven't slept well? Those are the things I teach in my Tiny Habits method. So increased physical activity is the most consistent positive correlate of weight loss maintenance, meaning that is the one that has shown the biggest benefits. Now, you may wonder, because I often say this, exercise alone is not going to make you lose weight. Now, listen, I'll repeat that. Exercise alone. So if you don't want to change your food at all, you don't want to overcome your food addictions, you want to continue eating sugary food and high carb food and bread and pasta and things like that, and you feel that all you have to do is go to the gym every day, and you realize that you don't lose enough weight, or you may have lost weight but you're not able to maintain. So important thing to remember is, for losing weight, exercise alone is not going to do the trick. But in the weight maintenance phase, where you've lost some weight and you want to retain those benefits, exercise but moderately to higher intensity exercise is extremely important. This is sometimes difficult for a lot of people to understand, that the strategies that you have used for weight loss may be different from the strategies that you're going to use for weight maintenance. And we are still trying to figure out, because the body goes through multiple changes once you lose weight. Maybe I'm going to talk about all that in greater detail some other time, but I don't want to delve too much into the science, because most of you don't need the science, but at the same time, these are the behavior changes that you can look at. There are many more things that you can do, but find out what you see yourself doing. As a Tiny Habits coach, I always say that don't follow the latest trend on some influencer on TikTok telling you this is the only thing you should do. Or another important thing that I find many of my patients struggle with is a friend of theirs have lost weight on blah, blah, blah diet. It could be a cabbage soup diet. And they feel they need to start on that. Nothing else will help them lose weight. That is also not true. Find things that you want to do. And slowly, as you build your, in the Tiny Habits method, as I teach that, as you build yourself up, small successes will increase your motivation naturally. It's not like I have to motivate myself to go to the gym today and you don't feel like getting out of bed. That is not an exciting way to live life. So moving forward, what will happen? You will receive a recording of this webinar. And if you have any questions, feel free to type in the chat box. And you will also receive emails in the future when I plan to start the PCOS, Tiny Habits for PCOS course. I'll be traveling next month. So October, November, I'm traveling in India and Indonesia. So I'm not going to have any webinars. December is a month where people like to go on holidays. So that is not a time when you want to start on a new program. January may be a good time because a lot of people make New Year resolutions. So keep me posted. And if you have any questions, feel free to email them to info, I-N-F-O, @drkarmd.com, drkarmd.com. And I may not, if I can answer, if it's a simple answer, I will answer it by email. Otherwise, at the next webinar or any of the events, I will respond to your question. So thank you. Now I'm going to stop sharing the screen. And do you have any questions? Just one more minute left. Okay. Okay, this is a question that has been sent to me on the chat. So the question is, if weight loss is not my goal now, what should I do? So the point is, if weight loss is not, so going back to what happened with Tina. Now, Tina, if you remember, she said she was not very keen on weight loss at that point. So, but once her mood got better, and this took time, it is not like today she came and met me and tomorrow she got her labs done and day after she was feeling absolutely fine. No, she got onto supplements. So it took her about 3 months to feel completely okay by the time her, all her nutrient levels went up. After that, she said, doctor, I think I'm now in a position where I want to focus on weight loss. So she started with time-restricted eating, lower carbohydrate food, intermittent fasting. So if weight loss is not one of your goals now, don't get worried about it. It's just because, someone else thinks, your doctor thinks you need to lose weight. You don't have to do that. Focus on what you want first. If you want better mood, if you want regular cycles, or if fertility is your goal, focus on those first. Now, of course, weight loss helps with fertility. So if you think that fertility is of primary importance because you are moving ahead with age, you're like 38, 39 years old, and you don't have a lot of, years left to wait, then it might even be valuable enough for you to get onto medications to lose weight immediately so that your fertility chances are better. Many people, are surprised when I say that I do support medications as well for weight loss, because the point is I am not either or. It's not either lifestyle or medications. It is what works best for you, for the results you want. So I hope that answers your question. Any other questions? Otherwise, I will end the webinar here. Thank you so much for investing your time with me. And I was surprised to find a few men had registered for my webinar. I wonder, perhaps they have some, loved one they want to help. Another point to note, if it is someone else you want to help, find out what that person wants and not what you want for that person. Okay. Bye now. So I've gone over my time by 1 minute, and see you all next time. And I don't know when next time will be, maybe January. Bye. Take care.